Did you know that there are 567,715 homeless individuals in the United States? It may not seem like a lot to you, but it's more than you think. Hi, I'm Haley Grace Agbayani, and I'm a junior from Maryknoll High School, located in Honolulu, Hawaii, and today I'll be talking about homelessness in the United States and shedding light on the reality behind it. First, the government and/or state should address the lack of proper health care for those who are homeless and have mental health problems or diseases. It's crucial to understand that they are more likely to develop diseases such as HIV or tuberculosis and conditions such as hepatitis C and diabetes. As for those who have a mental illness, which is about 20% of the homeless population, it's important for them to receive mental health care checkups. According to the U.S. National Library of Medicine, the average cost of mental health care is around $8,509 for 11 days. That's expensive. Because of this, according to the Committee on Healthcare for Homeless People, it has been stated that 9% of low-income individuals have been in situations in which they felt discouraged from seeking medical care due to financial reasons. Though it is unaffordable, it's important for those who have infectious diseases to receive treatment. If not, the chances of it spreading to the rest of society are high, which isn't ideal as the current pandemic, COVID-19, has been affected everyone around the world. Moving on to my second point, the federal government should provide affordable or low-income housing for those who are homeless. According to the Council of Economic Advisors, around 194,467 homeless individuals were unsheltered, living on sidewalks and in parks, cars, and abandoned buildings. Sleep is one of the biggest issues as a homeless individual because the chances of personal belongings being stolen or even being assaulted are high. But why not just seek a homeless shelter? Well, some homeless individuals believe that shelters are way more dangerous than the streets. It's chaos in there, man. I froze last night and my phone got stolen, said a homeless individual. Also, by creating affordable housing, it's less expensive than relying on law enforcement and medical interventions for those who are homeless. For example, a Research and Development Corporation analysis concluded that the Los Angeles County saved about 20% by providing supportive housing for those who have mental health issues. Through the use of the Housing for Health Permanent Supportive Housing Program, many were able to reduce the cost of service by 60%. This idea should be implemented into other states with a severe homeless population, as it was deemed a success. My third and last point explains that the government should recognize a rising economy and a low unemployment rate, which allows homelessness to persist. There's a significant number of homeless individuals who have struggled to achieve stable housing due to lack of employment or because of a low-paying job. According to Zillow, about 15% of the U.S. population are vulnerable to rising rents. A rising economy raises tax revenue and decreases the government on unemployment. However, most of the growth goes to certain people. It depends on one's financial and employment situation. According to the National Coalition for the Homeless, the benefits are focused on those who are wealthy or in the upper class. It doesn't make sense because it should be given to those who are in most need, such as homeless individuals or low-income families. After all, this could help keep them off the streets. Those who live and are employed in big cities such as New York, Seattle, and Los Angeles earn more money than people in other cities. Rising rents removes residents who live in condos, apartments, or houses. It may even push them to becoming evicted, which may cause them to even become homeless. It's important for our federal government to notice the changes within our economy and how it affects everyone, especially the homeless community. They should provide solutions that potentially help those in the homeless community to overall decrease the population. So, what has been done in the past regarding eradicating the homeless population that failed? Well, for example, according to Curb Los Angeles News, about 3,260 income-restricted rental apartments in the Los Angeles County will no longer be affordable and will soon become market rate. Low-income residents in California save about $320 a month by living in affordable housing, which allows room to pay for food, transportation, education, and health care. Completely suppressing the problem of homelessness is very complex, and in a way it seems very impossible. My partners and I have created a solution called Treats for the Streets, and although it may not necessarily solve homelessness, it may help aid it. Also, please note that this idea was proposed before we were all affected by COVID-19. We forethought on splitting preliminary costs between us three, which would have acted as our contribution to our cause. We were planning on baking cookies and brownies and packaging them into cellophane bags. Our project would have been funded through the proceeds we receive from selling these baked goods to family members, peers, teachers, or the community. 40% of the profits earned would have been donated to homeless shelter organizations in Hawaii, such as Family Promise of Hawaii, the Institute of Human Services, or Hawaii Food Bank. The remaining 60% would have gone towards purchasing items being put into shoeboxes, such as toiletries, canned goods, socks, or other basic necessities. Once the shoe boxes are fully packaged, my partners and I would have distributed them towards homeless families, but also homeless individuals on the island of Oahu. This solution may be feasible for those who are homeless because it gives them a sense of worth. It'll make them realize that there are people who care about their well-being. Of course, due to COVID-19, it isn't practical for this solution to be fully executed yet. But for now, we plan on donating necessities that homeless shelters need. Our nation and its federal government should create policies and long-term resolutions that addresses the lack of proper health care, the failure of affordable housing, and the rising of the economy to ensure the health and safety for those in the homeless community. Despite the efforts the federal agencies and states have done to implement proposals and programs to help eliminate homelessness, the growth of the homeless population in the United States has proved that more is to be done to solve this social issue. With the help of everyone, all ideas should be put forward, making it possible to find the best strategy to help combat this crisis that may benefit those who are homeless and the rest of the community. Thank you. For more information, visit HaleyGraceAgbayani.weebly.com.